This video provides an overview of anthrax, also known as zoonosis or wool sorter's disease, a critical topic for nursing exams. As Dr. APJ Abdul Kalam said, you have to dream before your dreams can come true. Keep this motivation as we explore the topic. Anthrax is an acute bacterial infectious disease caused by Bacillus anthracis. It is primarily a zoonotic disease, passed from infected herbivores like cattle and sheep. Humans are accidental hosts, usually infected through contact with animals or their products. The agent, Bacillus anthracis, is a gram-positive rod-shaped bacteria arranged in chains, giving it a quote 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 quote. It is aerobic, and a key feature is its ability to form highly resistant spores and a polypeptide capsule. Anthrax spores form when the bacteria is exposed to oxygen outside the body. These spores are highly resistant to heat and drying, surviving in soil for decades. They are only reliably killed by autoclaving at 121 degrees Celsius. Historically, Robert Koch first showed this bacterium-caused disease in 1876. Louis Pasteur developed the first live attenuated vaccine in 1881. Today, anthrax is recognized for its potential use as a biological weapon. Let's review the basics. The causative agent is Bacillus anthracis, which appears in chains, like a bamboo stick. It is not transmitted person to person. Louis Pasteur developed the vaccine. The epidemiological triad for anthrax involves B. anthracis spores as the agent. The hosts are natural herbivores and accidental human hosts exposed occupationally. The environment includes spores in soil or contaminated animal products. Anthrax is transmitted in 4 main ways: cutaneous, which is most common, through abraded skin; inhalation of airborne spores, which is the most deadly; gastrointestinal, by eating infected meat; and injection, seen in heroin users. Anthrax is often an occupational disease, or industrial anthrax. High-risk groups include farmers, butchers, wool sorters, tanners, and veterinarians who handle animals or their products. Anthrax is classified clinically into 4 main types: cutaneous, pulmonary, gastrointestinal, and injectional. Cutaneous anthrax, also called malignant pustule, is the most common type. It appears on exposed areas. The lesion evolves from a papule to a necrotic ulcer or eschar within 1 to 7 days. The anthrax eschar is a depressed black scab with a necrotic center. It is surrounded by edema and is notably painless. The name anthrax comes from the Greek word for coal due to this black lesion. The correct answer to the question is cutaneous anthrax. Pulmonary anthrax, or wool sorter's disease, is caused by inhaling spores. The pathology leads to hemorrhagic mediastinitis. Symptoms start flu-like and rapidly progress to severe respiratory distress, shock, and death. Gastrointestinal anthrax results from eating undercooked infected meat. It presents in intestinal or oropharyngeal forms with high mortality. Intestinal form includes bloody diarrhea and hematemesis. Oropharyngeal causes ulcers and neck swelling. To summarize the clinical aspects, wool sorter's disease affects the lungs. The characteristic ulcer is a painless black eschar. Cutaneous is the most common type, and pulmonary is the most fatal. B. anthracis produces a powerful exotoxin with 3 components: protective antigen, which helps entry into cells; lethal factor, causing necrosis; and edema factor, causing severe swelling. The correct answer to the question is Bacillus anthracis. Diagnoses by microscopy uses specimens like lesion swabs or blood. Gram stain shows large gram-positive rods. McFadden's reaction, using polychrome methylene blue, highlights the capsule as reddish-purple. Cultures on nutrient agar show a medusa head appearance. On blood agar, colonies are non-hemolytic. Gelatin stab yields an inverted fir tree pattern, and solid medium shows a frosted glass appearance. Ascoli's test is used to detect anthrax antigen in decomposed animal tissues, especially when the bacteria are dead. It is a ring precipitation test used for retrospective diagnoses in animals or products. The correct answer to the question is Ascoli's test. For cutaneous anthrax, the drug of choice is ciprofloxacin or doxycycline, usually for 7 to 10 days. If bioterrorism is suspected, extend the duration to 60 days. Early prognosis is excellent. Systemic anthrax is a medical emergency requiring multi-drug IV therapy, like ciprofloxacin or meropenem, plus clindamycin or linezolid to stop toxin production. Treatment involves IV drugs for 2 to 3 weeks, followed by oral antibiotics for a total of 60 days. Prevention in animals includes the Stern vaccine, a live spore vaccine used annually in endemic areas. Carcasses must be disposed of via deep burial with quicklime or incineration. Never open the carcass, as this releases spores. Prevention in humans involves the anthrax vaccine, given to high-risk groups. Personal protective equipment, like gloves and masks, should be used when handling animal products. Formaldehyde fumigation can disinfect wool. Post-exposure prophylaxis, or PEP, is given after exposure, such as in a bioterrorism attack. This includes 60 days of ciprofloxacin or doxycycline, combined with 3 doses of the anthrax vaccine. Anthrax is a high-priority Category A bioweapon agent because its stable spores are easy to disperse. The 2001 U.S. attacks involved spores in letters, appearing as a fine white powder. The correct answer to the question is ciprofloxacin. The correct answer to the question is postmortem examination, which is contraindicated. Nursing management focuses on standard precautions, as anthrax is not contagious human to human. Ensure proper skincare for ulcers and dispose of dressings as biohazard. Patient education must emphasize adherence to the full 60-day antibiotic course for systemic cases. Anthrax spores are resistant to common cleaning agents. Effective spore-killing disinfectants include chlorine, glutaraldehyde, and hydrogen peroxide. Instruments should be autoclaved and dressings incinerated. Final review. Cutaneous anthrax is also known as Hyde-Porter's disease. B. anthracis colonies are medusa head. PEP duration is 60 days. Anthrax is a bacterium, not a virus. Anthrax is classified as a Category A bioterrorism agent, alongside other high-priority biological threats. In summary, anthrax presents as 4 forms: cutaneous, inhalation or wool sorters, GI, and injection. Cutaneous is most common and involves an eschar, while inhalation is the deadliest. Key exam terms include bamboo stick appearance, spores, malignant pustule, wool sorters disease, mediastinal widening, Ascoli's test, McFadden reaction, and ciprofloxacin. Consider a case study: a shepherd with a painless ulcer that has a black, necrotic center surrounded by edema. The diagnosis is cutaneous anthrax, and treatment is oral ciprofloxacin. Remember to challenge your limits. Keep studying. You are future nursing officers. Thank you for watching this video. All the best for your NORCET and RRB exams. For further inquiries, you may contact Mr. Nagesh Sir at the provided number and email address.